Hello, and welcome to another live broadcast with MedStar Health. My name is Karen Zingle, and I'm joined today by Dr. Ankit Madan, hematologist and oncologist with MedStar Georgetown Cancer Institute at MedStar Southern Maryland Hospital Center. Are you a smoker, or do you know a loved one who smokes? Do you know that cigarette smoking is the #1 risk factor for lung cancer? And do you know that stopping smoking can save your life? Well, today we're going to talk about the importance of smoking cessation and its impact on reducing the risk of lung cancer. So thank you for tuning in. Give us a like, let us know that you're watching, share this broadcast with those friends and family members, and ask your questions in the comments below. Before we get started, let's meet our expert. Dr. Madan, thank you for joining us.
Thank you, Karen, for having me. It's a pleasure.
And can you tell our viewers a little bit about yourself before we get started?
Yes, so I'm a medical oncologist and hematologist at MedStar Georgetown Cancer Institute. My work location is MedStar Southern Maryland Hospital. I started here in August 2022. I did my training from University of Alabama, my residency and fellowship. And I've been working here seeing all cancer patients and blood disorders. So, Monday through Friday.
Okay, great. We're so happy to have you. So let's get into our questions. Let's just talk about those that are smoking. So those that have been smoking for a long time, is it too late for them to reduce their risk of lung cancer, even if they do quit?
So that's a good question, Karen. One thing I will say is it's never too late. It's never too late to do the right thing. We know that the relationship of lung cancer and smoking is dose dependent. 90% of our lung cancers are due to smoking. So when we smoke more, your risk goes high. So even if you've smoked 15 years or more, if you are to stop smoking, you can reduce your risk by 20 to 40% over the next 5 years. By stopping smoking, the risk reduction happens fast. However, if I find somebody who is not willing to quit, then by reducing their cigarettes to 50% of what they are doing right now, you can reduce your risk by 20% over a period of next 18 years based on studies. So it's never too late to quit. If you have those thoughts, and funnily, about 2/3 of the smoker are always thinking about quitting. And only a third of them will actually get help. So next time when you see your primary care physician or any specialist that you see, bring this up, that this is in your mind that I need to quit smoking, and get the help you need. I think what we see is people want to quit, and a lot of them who say they've tried everything, in reality, they've not tried a lot of things. So it's good to bring up with your provider.
That is great to hear. Thank you so much. Well, what about those casual social smokers? So those that are only smoking a few cigarettes a week, maybe when they're out in social situations, are they still at risk for lung cancer?
Yes. So as I said before, the risk is dose dependent. So the more you smoke, the higher the risk. So the risk is less if you smoke about few cigarettes a week, but it's not 0%. You're still at a higher risk of lung cancer as compared to a non-smoker. So, and the interesting thing is there is more cardiovascular risk to smoking 1 to 5 cigarettes a week. So we found in studies that those who smoked 1 to 5 cigarettes a day still have a 1.3 times higher chances of dying of a cardiovascular event as compared to those who don't smoke. So yes, your risk of lung cancer is not as high as somebody smoking a pack per day, but you could still end up being on the wrong side based on a cardiovascular event or a stroke. So all the more important to quit smoking or discuss this with your provider.
Okay, thank you. That's really good to know. What about electronic cigarettes? So those that are maybe looking to switch from your classic cigarette to an electronic cigarette, does that help reduce your risk for lung cancer?
Yes, so most definitely. So what are electronic cigarettes? These are new. They have come about in the last 10 years. Electronic cigarettes are nothing but nicotine delivery devices. So your the electronic cigarettes will have a battery that has an aerosolizer. What that does is the liquid that contains the nicotine and the flavor, it will aerosolize that liquid and give you the feeling that you're smoking without actually combusting a cigarette. So yes, in the short term, it has been found that the risk of lung cancer with the use of these electronic cigarettes is less as compared to a regular cigarette. So if somebody is unable to quit smoking, electronic cigarettes are less harmful than a regular cigarette. The long-term data is just not out there. It's fairly new in the market. Currently, we do not know what the carcinogenic potential of the liquid, which has polyethylene glycol, these flavors, formaldehyde. Would that have a long-term impact on your lungs or in your heart 20 years from now? I don't know. But those who are on e-cigarettes, it is much safer, less lung carcinogenic as compared to a regular cigarette. I won't recommend it I would because in recent times we found that people who were vaping or those who were using e-cigarettes, they had this acute lung injury, and it was mainly seen in those in which the liquid contained tetrahydrocannabinol. So you have this acute lung injury that can happen. So I recommend against it, but it's again a bit less harmful. I use the word less harmful rather than more safer. I use the word less harmful than a regular cigarette. Yes.
Okay. Could that be a good alternative in the short term if you're looking to quit, but some of the other methods haven't worked for you? Maybe a short term using the electronic cigarette to still get the nicotine. Maybe do you find that that's a potential good first step for some people?
Yes, and we've seen that, more people, when they're trying to quit, they ask me, do I use e-cigarettes? So I would say yes, if that gets you off your regular cigarettes because you're not combusting tar, not taking carbon monoxide, not taking the oxidant stress that comes with the regular cigarette. So yes, you can use that. But in the long term, I cannot give you the data because it's just not out there.
Okay.
And one thing I fear with the e-cigarettes is because we've seen in 2018 and 2019, not the COVID year, we saw a rise in middle schoolers and high schoolers using more e-cigarettes. So my apprehension is the e-cigarette kind of normalizes the smoking behavior in the younger people. And that's why I'm a bit hesitant and telling you, hey, go use it. But yes, if you had a choice, I would have that is less harmful.
Okay. Yep. That makes sense. Thank you so much. So we're going to transition and talk about smoking cessation in just a moment, but I want to take a minute to welcome any viewers that just joined us. I'm joined today by Dr. Ankit Madan, hematologist and oncologist with MedStar Georgetown Cancer Institute at MedStar Southern Maryland Hospital Center. We're talking about the importance of smoking cessation and its impact on reducing the risk of lung cancer. So we've talked about smoking, the amount of time, the different risks. Now we're going to talk about smoking cessation. Dr. Madan, what are some of the treatments that can help with smoking cessation?
Yes, so we have 3 major treatments out there. First one is using medications called pharmacotherapy that usually involves 3 medications. The first one is varenicline, which is the most common one. Then you have bupropion, and then rarely we can use nortriptyline. So this is the pharmacotherapy. So varenicline is the most common one. It's out there in the market with different names. It works by stimulating the same receptors that nicotine would. And how that works is it decreases your craving for having a cigarette. So over time, we've seen you use it 1 tablet of 0.5 milligram for 3 days, you up the dose to 2 tablets a day, and then you up the dose to 1 milligram twice a day, and you go for 3 to 6 months. We've seen patients who use that, 44% were off smoking by 6 months and 21% were abstinent from smoking at 12 months. So it does work as better compared to bupropion. The only patients I feel we need to use a lower dose is those with kidney problems. It needs to be kind of watched carefully and avoided in people who are actively depressed because it can cause some of the worsening of the symptoms. Patients who take this medication sometimes report to me of nausea, headache, abnormal dreams, difficulty sleeping. Second line, I use bupropion, which is also another antidepressant medication. Kind of safe, better to be used as a second line, and then we can use nortriptyline. I use these methods on patients who smoke heavy, okay? And these include those who smoke within 30 minutes of waking up, using more than 15 cigarettes a day, or those who started using cigarettes at an early age in their teenage years. Then you have, for light smokers, I've tried using nicotine replacement therapy alone. What that means is we have a long-acting nicotine delivering agent, like a nicotine patch or a nicotine spray. I prefer using patches. You combine that, don't use that in single, but combine that with a short-acting nicotine agent like a gum or a lozenge, which is actually available over the counter. So you combine a long and a short-acting nicotine replacement agent for light smokers. And then the third therapy, which is the most important one, is the behavioral therapy. If somebody is, like you mentioned, a casual smoker, who smokes rarely, those can be treated just with behavioral therapy. So you can identify their triggers and work on those triggers. And what is most important is continued follow-up. So studies have shown me just telling a patient that, hey, you need to quit, and offering a pharmacotherapy is not as strong as actually offering the pharmacotherapy and then following up. Following up, that provides continuous motivation to quit, because a lot of patients will relapse. On an average, patients relapse 4 to 5 times. So continued observation, behavioral therapy is important. So these are the 3 chief therapies out there.
Thank you. What have you found to be the most effective intervention for smoking cessation?
So in my practice, varenicline followed by behavioral therapy. The combination is more beneficial than single agent. Sometimes we have to use a combination of medications and nicotine replacement, which is better as compared to either of them done by themselves. But you have to be careful when you're using a combination therapy, because patients tend to have a bit more side effects when you use combination therapy. But I think if you can combine pharmacotherapy or nicotine replacement with adequate follow-up and behavioral modification, that is the best therapy.
All right, thank you. Let's talk about some benefits of quitting smoking. Can you talk about those benefits? You mentioned earlier those smokers who could also have cardiovascular issues. What other benefits, including that, would someone get from quitting smoking?
Yes. So, the risk from, first of all, there are about 500,000, 480,000 people who die from cigarette smoking in the US every year. 7 million worldwide will die from tobacco-related deaths. Major harm from smoking comes from cardiovascular risk, developing cancers that can be cancers of the oral cavity, your urinary bladder, stomach, gastric, you name it, lung. And thirdly, COPD and other lung problems. So of course, by quitting smoking, you are reducing your risk of all these 3 disorders. Some of the other benefits that you see, your exercise tolerance will get better. You will breathe better. A lot of times your ability to taste and smell food becomes better over time. Let's be honest, you save money. These days, health insurances want you to get tobacco testing. We have, tobacco-free incentives with health insurance. You get premiums, get money off your premium if you don't smoke. Then, frankly, you feel better, you smell better. We've always seen people who smoke, they smell differently, their cars smell differently, their house smell differently. So that all goes away when you quit smoking. And frankly, that's the best thing to do.
That's a lot of benefits. Thank you for that. Are there any statistics that demonstrate how much risk is reduced if someone quits smoking, and what are they?
Yes, so absolutely. So the best paper out there, if somebody can go and Google it, we use Google often, is to look at a paper from 2013 that was published in New England Journal of Medicine. It's called 21st Century Smoking and Cessation of Smoking in United States. So what that study did, it looked at about 200,000 men and women, those who were smoker and non-smokers. The study found patients who smoke live 10 years less than those who don't smoke. The probability of making the age of 79 is twice as much if you're not a smoker as compared to if you smoke. If you were to quit between the age of 25 to 34, you're adding 10 years to your life. Wow. If you quit between 36 to 44, you add 9 years. If you quit between 44 to 54, you add 6 years. So the early that you quit, the better it is. You're adding 10 years to your life. If you quit after 60, you're adding 3 years to your life. So that's a great paper, a resource that I found. And you can actually, add a decade to your life if you quit before 35.
Wow. That's incredible. Thank you for that. What about community resources? What community resources are available to help those that are looking to quit and need help with smoking cessation?
Yes, so I would advise statewide, nationwide, there's a 1800 number called 1800 Quit Now. Every state has that. You can dial that number. For people living in Prince George's County, there's an 1800 number called 800-662-HELP. Prince George's County also has smoking cessation office in Landover, where they can help with smoking cessation classes, offering nicotine patches and gums. But if you use the 1800 number or go online and search for your county's smoking cessation, every county in Maryland currently offers help with smoking cessation. And they have coordinators for that.
Okay, that's great. Thank you so much. What about, let's talk a little bit more about our non-smokers who live with someone who smokes. So if I'm a non-smoker, but I live with someone who is a smoker, am I at risk for developing lung cancer?
Yes, unfortunately. So as I said earlier, 90% of the lung cancer is from smoking. 1% of lung cancer happens in non-smokers. And among those non-smokers, a fifth of those, 20% of those, are exposed to secondhand smoking. So it is unfortunate that happens. Kids are more at risk because they start getting exposed earlier in their age. Risk goes up once you've been exposed for 25 smoke years, which means that if somebody around you smokes a pack a day for 25 years or 2 packs a day for 12 and a half years, your personal risk, even though you're a non-smoker, goes up. Studies have found spouses of patients who smoke have a higher risk of cardiovascular disease and lung cancer itself, as well as if at your workplace you're exposed, your risk goes up. The risk is about 1.3 times higher as compared to a non-smoker.
Wow. Okay. So even more reason to quit smoking.
Yes. So that I think in your benefits to smoking, if you quit smoking, you're helping your kids, your spouse live longer as well.
Yep, absolutely. Let's talk about lung cancer screening. Can you talk about the criteria for lung cancer screening and when someone should be screened for lung cancer?
Yes. So, initially with the National Lung Cancer Screening Trial, it looked at patients between the age of 55 and 74, those who've smoked 30-pack years. But most recently, it was updated we wanted to broaden the coverage for getting annual CT scans. So currently, if you're between the age of 50 and 80, if you've smoked for 20 pack years, currently smoking or quit within the last 15 years, you are eligible for an annual low dose CT scan for 3 years. The reason for screening for lung cancer is to catch the lung cancer when it's early, when it's curable through surgery, rather than wait for those nodules to turn into cancer and be diagnosed at stage 4. So you're living longer by getting these CT scans.
Yep. Thank you so much for sharing that. So we've talked about a lot today. I feel hopefully motivated our viewers to take the next steps to improve their health and to quit smoking. And those that are smoking, getting screened, hopefully that, quit, but getting screened to catch anything early. Hopefully they aren't diagnosed with lung cancer, but if they are, they catch it early. Is there any other messages, or what are the key takeaways that you want to make sure that our viewers get from this discussion before we wrap up?
Yes, so one thing I would say is that seek help. Earlier you quit, as we discussed, earlier quit, you can add decade to 9 years to your life. And help is out there. You just have to go and get it. A majority of the smokers do contemplate thinking, 2/3 of them, but actually only a less than a third actually get to the medicine part. So speak to your regular care provider, reach out to them. It's never too late to quit smoking.
That is a great message. Thank you so much, Dr. Madan. We really appreciate you joining us today, providing all this wonderful information. We covered a lot. The replay will be available to those that are watching and want to listen again to all the benefits and the resources and the risks that Dr. Madan talked about today. But that wraps up our broadcast. Thank you so much for joining us, Dr. Madan. Thank you for the time. Thank you to our viewers for being with us today. We hope you have had a chance to get motivated to quit smoking, and you can motivate your friends and family members who are also smokers. So thanks for joining us, and we'll see you next time.
Thank you, Karen, for having me.
Of course.